obviously I have to have to disclose that obviously neither of us are medical experts in the field. But do you think the UK will recover from the coronavirus, or do you think we'll face a second wave?
Again, this is one that I've like actually got no idea on, and my
Oh, come on.
mind goes round in circles all the time. So obviously, I think
Yeah.
like the pandemic's been handled really badly. I don't think like we should be opening pubs and saying like go get drunk if we're not allowed to like open gyms or like you're not allowed to do one-on-one personal training inside. You're not allowed to go get your nails done, but you can go get drunk. I think the response has definitely been focused on the economy rather than public health, which is why we've had so many deaths and it's been a bit of a catastrophe, really. But in terms of a second wave, I'm not sure because I don't really know how it works. My confusion is how do we ever get rid of the virus? Doesn't it just keep spreading around
It's like
forever?
a second. Well, when a vaccine hopefully comes out, it's like a second wave. It's like say like so it'll peak at say it peaks at 10,000, then it drops down to say much lower number, say a few hundred, and then it spikes back up. So that's what they call a second wave. So it'd be like
Um,
the first
I
round
think
comes
if there's
in.
gonna be a second wave, we're doing everything in our power to make it happen.
I've seen obviously in America. So if you look at the numbers in, I think it's Texas. Their hospitals are. I think it's Austin, Texas. I think it is. Their hospitals are at max capacity right now, and so you'll get a lot of people who die. Who those ones. I think in Italy they had the same problem where because the hospitals and the ICUs were in max capacity, they basically chose who lived and who died, which is terrifying in itself. But yeah, I feel like we are looking. I think closer towards a second wave. Like local lockdowns would become a much bigger thing, like because now all the councils have the Pillar Two data, which they didn't have prior to the end of last month. So I think I don't know what the social distancing is like in Grimsby, like people keeping their distance or.
So, I mean, nobody's really been doing it here, but then nobody's really, there's not been that many cases of it here either. I mean, a lot of people think that like it went round in December, January time. Um, but obviously none of that's been looked into yet.
You'd have to
Um,
antibody tests, I think, to figure that one out. So